Your brain doesn't stop working as you age. But after 60, something shifts, and most people miss it completely. That heaviness in one arm, words stuck somewhere between your brain and your mouth. You stand up, the room tilts for a second, and you think, I got up too fast. Here's where your doctor probably hasn't told you clearly enough. A mini stroke has no pain. None. It's the only neurological emergency with no alarm bell. No chest pain. No screaming signal. It can come and go in 4 minutes, and it will never announce itself as a stroke. What it sends instead is quiet. A few seconds of blurred vision. A stumble on a step you've climbed 1,000 times. A word you suddenly can't find. You blame tiredness. You blame age. You blame a bad night's sleep. Meanwhile, your brain just sent you a warning you didn't know to read. The standard advice, watch your blood pressure, reduce salt, exercise more, take your aspirin, is correct. It's just incomplete. It manages your risk. It doesn't teach you to recognize the event when it's already happening. And after 60, recognizing the event is what saves your life. There are 7 warning signs neurologists look for after a suspected mini-stroke. 7. Most people know one. The face drooping. The rest? Almost nobody talks about them. Some look exactly like normal aging. Some last under a minute. And one of them, number 3 on this list, is probably the most dismissed warning sign in all of neurology. I'm walking you through all 7. Ranked. What to look for, what it means biologically, and what the research actually says. The last one, number 1, is the one you need to understand before tonight. Before we get into the list, here's what's actually happening during a mini-stroke. Because most people have it completely backwards. They think a TIA is a small stroke. It isn't. A TIA is a temporary blockage. Blood flow to a section of your brain gets cut off, usually by a tiny clot or a momentary collapse in a narrowed artery. The blockage clears. The brain recovers. Symptoms vanish. But the artery that just blocked is still there. Still narrowed. Still vulnerable. That's what every warning sign on this list is pointing to. Number 7. A sudden, severe headache with no known cause. On a score, 4 out of 10. Why it ranks low? Headache is a symptom of almost everything. Dehydration, stress, poor sleep, high blood pressure. The list is endless. But there's a specific type linked to TIA. Neurologists call it a thunderclap, pain that arrives within seconds, not minutes. Not a dull ache that builds. A sudden, sharp, maximum intensity pain. Often described as the worst headache of your life. On its own, it's vague. Combined with any other symptom on this list, it becomes an emergency. One critical caution: if you're on blood thinners and get any sudden severe headache, call 911 immediately. That combination can signal a hemorrhagic stroke. Score: 4 out of 10. Worth knowing. But what comes next goes much further. Number 6. Sudden numbness or weakness on one side of the body. Score: 6 out of 10. Most people know this one. What they miss is the one-sided detail. That's the diagnostic key. A TIA affects one hemisphere of the brain. And because your brain is wired in a cross pattern, left side controls the right side of your body, right controls left. A blockage produces weakness in one arm, one leg, or one side of the face. Not both arms. Not all 4 limbs. One side. That's what separates a TIA from low blood sugar or a circulation issue, which produce more widespread, symmetrical symptoms. And the catch: it can be subtle. A hand that feels heavier than usual. A foot that drags slightly. A corner of the mouth that drops for just a moment. Don't wait for full paralysis. The subtle version still counts. Score: 6 out of 10. Familiar to many. Missed in its milder form far too often. Number 5. Sudden confusion or difficulty understanding what someone is saying. Score: 7 out of 10. This is different from trouble speaking. This is the receiving end. You hear the words. They don't make sense. Someone says a sentence, and it's as if they're speaking another language. You read a sign, a text, a menu, and the words won't process. You read the same line twice, 3 times. The language processing centers sit in very specific locations in the left hemisphere. Disrupt blood flow there, even briefly, and this is exactly what happens. Research found that up to 85% of TIA patients showed some form of cognitive abnormality within 24 hours of the event. Most chalked it up to fatigue. Never reported it. In a TIA, this confusion resolves within minutes. But its disappearance doesn't mean it didn't happen. Score: 7 out of 10. Surprisingly common. Surprisingly ignored. Number 4. Sudden loss of balance or coordination, including dizziness that hits without warning. Score: 8 out of 10. This is one of the most dismissed symptoms in medicine. Dizziness gets blamed on everything. Dehydration, inner ear, standing up too fast, blood pressure medication. And most of the time, those explanations are right. But neurological dizziness has a specific character. It comes on suddenly. It brings vertigo, the room spinning, or the feeling you're moving when you're standing still. It may pair with difficulty walking straight, reaching for something and missing, or a stumble with no obstacle in the way. The B-FAST acronym, used by the American Stroke Association, starts with B for balance, not as an afterthought. First, because sudden balance disruption is one of the earliest and most overlooked signs. Seniors blame a stumble on clumsiness, a momentary dizziness on age. They sit down, feel better in a few minutes, and move on. That's the gap. Score: 8 out of 10. Common, frequently missed, and critically important. Number 3. Sudden difficulty speaking, slurred words, or words that come out wrong. Score: 8.5 out of 10. This is the most commonly dismissed warning sign on this list. It doesn't look like what you expect. You expect thick, stumbling speech, like someone who's had too much to drink. That happens. But there's a subtler version. You mean to say kitchen and window comes out. You start a sentence and the wrong word finishes it. Or you go blank mid-thought, not because you forgot, but because the word simply isn't there. This is called aphasia. In a TIA, it can last seconds. 1 minute. Then it resolves. And because it's embarrassing, because it passed, people don't report it. Harvard Health warns that people ignore these symptoms precisely because they disappear so quickly. The temporary nature is exactly what makes it dangerous. Difficulty speaking is one of the highest specificity symptoms for TIA. The brain's speech production center is small and precise. When blood supply gets interrupted, there is one outcome. Speech fails. If words came out wrong, even once, even briefly, that's your brain telling you something about the plumbing. Score: 8.5 out of 10. The most ignored warning sign on this list. Do not ignore it. Now, before number 1, I need to cover number 2, because this one stopped me cold when I first read the research. Number 2. Sudden vision changes, specifically in one eye. Score: 9 out of 10. There is a TIA-specific vision symptom with a name most people have never heard. It's called amaurosis fugax. Translated from Latin, dark fleeting. Here's what it looks like. You're sitting normally. Then, without warning, vision in one eye starts to fade, from the top down, or from the edges inward, like a dark curtain slowly being drawn across your field of view. One eye only. It lasts seconds, maybe a few minutes. Then it lifts, like a curtain being pulled back. This happens because the blood supply to the retina is being briefly cut off. The same clot or arterial narrowing threatening the brain is threatening the eye fed by the same carotid artery. Approximately 1/3 of TIA patients who experience visual symptoms report this specific curtain effect, yet it is rarely discussed outside a neurology office. People dismiss it as a visual migraine. Tired eyes. They wait for it to pass. It does. And they never mention it to a doctor. One eye. Sudden. Temporary. Like a curtain. If that has happened to you, or to anyone you love, that needs a medical evaluation today. Score: 9 out of 10. Almost universally underreported. And deeply important. Number 1. The number 1 warning sign isn't a specific sensation. You can't point to it on a diagram. It's this: symptoms that disappear. And I mean that medically, with hard numbers. Harvard Medical School reports that about 1/3 of everyone who has a TIA will go on to have a full stroke. Significant. But here's the part almost nobody knows. The risk isn't spread evenly over months. It's concentrated. Up to 10% of people who have a TIA experience a full stroke within 2 days. The FASTER trial, University of Calgary, found that 50% of strokes occurring in the 3 months after a TIA happen within the first 48 to 72 hours. Half. Within 48 to 72 hours. Read that again. Here's why the symptoms vanished. The blockage cleared. The clot dissolved or moved on. But the narrowed artery that allowed that clot to form, it's still there. Unchanged. The danger didn't leave. The signal left. Most people interpret disappearing symptoms as good news. The brain is interpreting it as a near miss. 2 very different readings of the same event. The single most dangerous thing you can do after a TIA is wait to see if it happens again. Here's what must happen instead. The moment you experience any combination of these 7 warning signs, even if they resolve in minutes, call 911. Don't drive yourself. Don't wait until morning. Don't call your doctor's office for an appointment next week. This is a medical emergency, regardless of how you feel afterward. Neurologists can assess your stroke risk in the next 48 hours. Start antiplatelet medications. Examine the carotid arteries with ultrasound. Begin interventions that dramatically reduce your risk. None of that is possible if you're at home waiting for it to happen again. A TIA is not a small stroke. It is a window, and it is a narrow one. Score 10 out of 10. Not because it's the most dramatic symptom, but because misunderstanding this sign is where the most lives are lost. Quick and important. This video is information, not a diagnosis, not a prescription. If you take blood thinners, have atrial fibrillation, a history of stroke or TIA, uncontrolled high blood pressure, or carotid artery disease, every warning sign on this list means call your doctor immediately. Not probably fine. Not wait and see. Call. And if you're having symptoms right now, stop the video. Call 911. Here's how to actually use what you just learned. Starting today. First, share this video with one person over 60. A parent, a spouse, a friend. Most people who have a TIA don't recognize what's happening to them. Someone else recognizing it and calling 911 is often what saves them. This information isn't just for you. Second, memorize be fast. Right now. B, balance. Sudden loss. E, eyes. Sudden vision change in one eye. F, face. One-sided drooping. A, arms. Sudden weakness on one side. S, speech. Slurred or wrong words. T, time. Call 911. Immediately. Write it down if you need to. Put it somewhere visible. Third, if you're over 60 and haven't had your carotid arteries checked, ask your doctor about a carotid ultrasound at your next visit. Simple. Non-invasive. It can detect narrowing before an event occurs. Consistency, not panic. But not waiting either. Starting tonight, the next time something feels off, even for a minute, you know what to ask. You know what you're looking for. That's the strange thing about the brain after 60. It doesn't shout when it needs help. It whispers. A word that disappears. A curtain across one eye. A stumble that passes in seconds. Most people never learn to hear those whispers. You now can. If this helped you, share it. It might be the most important thing you send this week.